Today's been awesome so far. Let me just do a little brief recap. We heard about the importance of genomic-led cancer care. We heard about how the amazing work being done overseas and what we're up to in Australia. And in the last session, we looked at the role of lived experience in shaping services and outcomes and the really practical challenges of ensuring that every person has access to the latest and best treatments. And of course, we've heard really inspiring stories from Natalie and from Kevin sharing the carer experience. In this session, we'll hear more about the quality of life, living with cancer, the role of supportive care, and then finally, we're going to call on everyone, as I mentioned, to take action to make it personal for everyone affected by cancer. So let's dive in. Our first speaker is Tenielle Jordan. Tanil is an amazing patient advocate who was diagnosed with colorectal cancer just after her 33rd birthday. She spent the last 3 years living with advanced cancer and is still undergoing active treatment. But she's also, and one of the things we want to talk about in this session is that you're not your diagnosis. You are a person with a diagnosis, but you are not your diagnosis. She's working full-time as a General Counsel for a large investment fund manager, thanks to a very supportive employer. And she's received exceptional care at Chris O'Brien Lifehouse, and we're very glad to have Gail O'Brien with us today. Her story also highlights the impact that a lack of research and resources can have on the patient experience. So please give a big warm welcome to Tenielle.
Hi everyone, and what a beautiful day it is to be here on Ngunnawal country. I'm really just feel so delighted to be here. So my name's Tenielle Jordan. My friends call me TJ, and so you're all welcome to call me TJ. It's so wonderful to meet you all, and I'm really grateful to Rare Cancers Australia for inviting me to speak today. I sometimes joke to my husband that I'm the world's luckiest stage 4 cancer patient. I know it's a low bar, and I'm sorry, Kev, I'm bringing up luck again. But it's because despite everything, there are so many silver linings in my journey. And one of them is being here and meeting everyone and making so many new friends at this conference. And another one of them is being a patient at Chris O'Brien Lifehouse, which is one of the best cancer treatment centres in the country. So my healthcare team, from my surgeons and oncologists to the nurses and supportive care professionals, are all best in class. And I wanted to start by saying this because I want you to keep it in mind as you hear my story. This is best in class care in Australia. All of the challenges I've met along the way are not because I don't have incredible doctors. It's because those incredible doctors are operating in a system that currently doesn't work as well as it should, and we all need to change that. So I was diagnosed with bowel cancer a month after my 33rd birthday, 7 months after my symptoms first started. And it's funny, until I sat down to think about what I was going to say today, I didn't fully appreciate how long that was. But for 7 months, I was vomiting constantly, at least once every day or two, whenever I ate a standard-sized meal. We tested for infections, viruses, parasites, all negative. Notwithstanding the increasing rate of bowel cancer among young people, the prospect of me having cancer was never raised. Ultimately, I was diagnosed with a delayed gastric emptying condition and was told that if I ate small portions and took the prescribed medicine, I should be okay. But just to be safe, a colonoscopy was booked for 2 months later, which I could cancel if the treatment was going well. And for the most part, it was going well. It was a week out from my colonoscopy. The day I was going to cancel it, I ate too much food and I started vomiting uncontrollably again. I told myself, I'm just eating too much, the drugs aren't foolproof, I need to have better self-control, but I figured I'd keep the colonoscopy booked just to be safe. Even as I was wheeled into the theatre for that colonoscopy, I remember my gastroenterologist telling me this was all a precaution. Then I woke up to hear they found a mass in my bowel and it looked like cancer. Even with access to the best doctors and facilities in the country, it took 7 months to get to that point. And this isn't an uncommon story. Christine told us today that the RCA's report says that over 20% of patients with a rare or less common cancer are waiting more than 6 months to be diagnosed. Within a week of diagnosis, I'd had surgery and started 12 rounds of chemotherapy. 8 months later, my scans were all clear, the emergency ileostomy I had was reversed, and I was given a clean bill of health. I was referred to Sydney Cancer Survivorship Centre for routine surveillance, but I genuinely never expected to walk into the hospital as a cancer patient again. 12 months later, thinking my extreme exhaustion was from low iron and B12, I was faced with extensive peritoneal metastasis. So in March last year, I was back in the operating theatre for a specialised surgery where they removed my ovaries, uterus, cervix, gallbladder, spleen, more of my small and large bowel, parts of my abdominal lining, and my omentum. My omentum. They removed parts of my body that I didn't even know existed. They then filled my body with my abdominal cavity with heated chemotherapy to kill any residual cancer cells before stitching me back up and sending me to the ICU. Now, I can't overstate how grateful I am for this surgery. But at 35, I was thrown into surgical menopause, I became permanently immunosuppressed, and the way my body works was irreparably changed. 2 months later, I was told my cancer had a BRAF mutation, which can cause aggressive tumour growth and doesn't always respond to traditional treatments. That mutation had been there all along. It was in the tumour they took out of me 2 years earlier. And so I'm a lawyer, I'm not a doctor, but it made no sense to me. Surely that is something that should form my treatment options from the start. But as I learned, and as we've heard today, it's standard practice for genomic testing of tumours only to be undertaken for advanced cancers, not for stage 2 patients like I was initially, even where there may be predictive factors of mutation. Soon after my initial diagnosis originally, they'd conducted testing to determine whether I had any genetic or hereditary factors that may have led to me having cancer in the first place. Thankfully, in my family, these are all negative, and so with the information we have today, and hopefully that might change with what we've heard earlier today, there was no genetic cause for me to have cancer. As it stands today, I'm just unlucky. But there was never a mention of genomic testing on the tumour itself. Again, I'm not a medical professional, I'm just a lawyer. I didn't know about it, and given it was standard practice, it was never brought up. I didn't know to ask. But this standard practice means there are patients out there with cancer in stages 1 to 3 who may have rare or aggressive mutations that may not respond well to traditional treatment regimes and who may, unbeknownst to them, be at a much higher risk of their cancer progressing. I often wonder if the regulations and protocols were different and the BRAF mutation had been identified earlier, if we could have caught the recurrence sooner and minimised the extent of the spread. Maybe I could have kept my reproductive organs instead of being thrown into early menopause. I worry about whether other young women, many of whom may want families, are going to end up in the same position as me because we're not testing for and catching these rare mutations early enough. But then the reality is, even if we did test early enough, we still haven't done the research to see if the treatment protocols should change. As a result, many of these patients would be ineligible to receive the targeted treatments that may delay the spread because these trials haven't been done to demonstrate the value of their use in earlier stages. And I think this is a great example of one of the themes we're touching on today. This part of my story demonstrates that when the system is designed only to focus on the disease, not on the person, we see people slip through the gaps. And it's not just me, it's not just a few people, it's thousands of people. Today, thankfully, we do have a fuller picture of my cancer. And I am, unlike my friends Caitlin and Natalie, lucky enough to be on a targeted treatment that is approved for use on the PBS. 3 years ago, that wasn't the case for this treatment I'm on. And if I'd wanted the best chance of living a life with my cancer under control, I would have had to pay an exorbitant amount for the privilege. My cancer is considered treatable, but not curable, and so our plan is to continue this treatment for as long as it's effective, but I worry about the day it stops working, and whether, if something new has become available by then, if it will be subsidised or not. I can't think about it for too long, and I can't hear the stories of my friends over here because I worry that I too would one day need to make a choice between draining my superannuation to pay for medical expenses or ensuring my husband would have enough money to pay the mortgage if I'm not here. Our medical system is such a source of pride for Australians. I often get told, and I'm sure a lot of people with cancer often get told, at least it's not like America. But in some cases it is. In some cases, being wealthy in Australia does afford you the best care because it relieves the burden of having to make a choice between getting life-saving treatment and ensuring your family is secure. We need to do better, and we can do better, and frankly, I don't understand why we're not doing better. But what makes the situation worse is that for many patients, the burden of living with cancer doesn't stop with the surgery or the medicine. For some of us, the same surgeries that keep us alive often debilitate us. For me, the side effects of my surgeries and treatments have been life-changing. My body aches in ways it never did before, and I struggle to do a lot of the things I love. I know so many patients just accept these side effects as part and parcel of having cancer. The pain, the exhaustion, the brain fog. We all know about them, but they're more of the ever-mounting costs that we pay for the privilege of staying alive. But in reality, this is just another place where there is so much room for improvement in our system. I mentioned at the start how lucky I am to be a patient at Chris O'Brien Lifehouse, and that's never more true than when I think about the supportive care that wraps around my treatment. After me, you'll hear from my integrative oncologist, Associate Professor Judith Lacey. She leads an incredible supportive care facility at my hospital called The Living Room. The Living Room has massage therapists, acupuncturists, yoga and mindfulness practitioners, reflexology and exercise physiologists, and they all help patients feel the best they can while undergoing treatment. It's a little utopia of professionals who specialise in an oncological setting and who are familiar with the side effects of our treatments and surgeries in a way community health providers aren't. Before I started treatment, I did boxing, ocean swimming, HIIT training, you name it. Now, 3 years later, I'm a bit of a Frankenstein's cancer patient with how my body works. I have 2 frozen shoulders, I have lame abdominal muscles, an aching back, and constantly low iron levels. The reality for me is I can no longer go safely into a community gym and do classes in the same way I used to. I also can't afford a personal trainer every week to help me move and progress my fitness in a way that works for my body and keeps me healthy. But I'm so lucky that twice a week I get to go to the gym at the Living Room and work out under the supervision of Lifehouse's exercise physiologists. I have a personalised program that helps me exercise safely in a way that not only doesn't exacerbate, but helps treat my injuries while allowing me to progress, stay healthy, and get stronger. And I do this alongside other patients where there is no judgment about our wonky bodies. It's just a beautiful environment where patients are given an opportunity to alleviate physical side effects of treatment in a safe, fun, and supportive environment. Even on my worst days, when I'm exhausted or in pain, I joke that I'm just at the hospital for the vibes, because there is never a day that I don't walk out of that gym feeling better than when I went in. And to me, it seems obvious that this is how cancer treatment should be. But I'm so surprised there are only a handful of facilities that offer patients ongoing supportive care like this. In fact, RCA's support shows that 25% of patients wanted to be referred to physical or occupational therapy, but were not. We know the benefits exercise has on cancer. The challenge study demonstrated it, and I know there are patients out there who are not exercising because they don't have a way to do it safely, or they aren't getting support in other ways to make them feel well enough to do it. And I know that because I would be one of those patients. I understand the metrics of our healthcare system focus on how many patients are living with cancer or how long they're living, but it doesn't seem to take into account how well they're living and whether their lives are worth living with the side effects of their treatment. I think for our system to run efficiently, we also need to look at how patients are feeling mentally and physically. Again, I'm not an expert, as I've said, but I'd almost guarantee the long-term outcomes are better when you treat the whole person rather than just one part of it. I just want to finish by saying one thing. When I received the email inviting me to speak today, I burst into tears in the office, as my colleagues, who I'm sure will watch this replay, will remember. And it's not because I was nervous or worried about being up here speaking to this room full of beautiful people, but it's because I'm genuinely so excited and hopeful about the impact listening to patient voices can have. For those in the room who are responsible for changing policy or impacting treatment options for patients and their family, when you go back to your desks tomorrow, you'll be making decisions that can impact and change my life, the lives of other patients, and the lives of future patients. But I'm probably preaching to the converted here because you all are in this room. And so we need to get that message out to the people not in this room today. So I want you to leave and take that back to your offices or back to your workplaces, back to your hospitals. And I hope you leave feeling energised and ready to drive change in the sector so that in future, fewer patients like me are left wondering how things could have been different. Thank you.